to October 1st, which at the moment may seem like a long time away. It's never a long time away, and it'll be here before you know it. And that's when the open enrollment process begins for Pennsylvania's health insurance exchange under the Affordable Care Act. We have a lot of work to do in a relatively short period of time, but we're Philadelphians. We know how to get stuff done and make things happen. That's what this city has been about for some time. And we're going to make sure that our fellow Philadelphians, those who have been on the sidelines, those who have at times been left out and locked out of getting affordable health insurance, now can get it because the President worked so hard to make sure it could happen. Today's meeting was an important starting point, but as our stakeholders certainly know, we do have a lot more work to do. And we get to do that work under the great leadership of Secretary Sebelius and the entire U.S. Department of Health and Human Services team on the ground here and in Washington. So it gives me great pleasure and pride to ask to come to our microphone here the Health and Human Secretary for the United States of America, Secretary Kathleen Sebelius.
Thank you, sir. Thank you. Well, I want to start by thanking Mayor Nutter for inviting me back to Philadelphia. There can't be a better champion for the constituents here in Philadelphia and a better partner for President Obama than Mayor Michael Nutter, who actually was an early supporter of the Affordable Care Act, helped us talk about how it was going to impact his constituents, his citizens here in Philadelphia, and helped to drive this message across the country. So it's really fitting that at the early start of 2013, which is a very exciting year for millions of Americans, that I would come back to Philadelphia. I also want to recognize Joanne Grossi, who is our regional administrator here in the office here in Pennsylvania, but actually responsible for a number of states in this area. So right now, we know there are about 48 million Americans who are without health insurance every day. And as the mayor said, over 200,000 of those folks are right here in Philadelphia. But thanks to the Affordable Care Act, starting on the 1st of October, there'll be an open enrollment period for people who are eligible to go to a new health marketplace and find insurance that works for themselves and their families. And this product will be more affordable than ever before because about 90% of those uninsured individuals will qualify for some federal assistance for either an accelerated tax credit or, if Pennsylvania chooses to expand Medicaid, for the Medicaid program. We know that about 75,000 of those individuals are Medicaid eligible. And beginning January 1st, Pennsylvania would be entitled to enroll new citizens across this state in Medicaid and have the federal government bear 100% of those costs for calendar years 2014, 15, and 16. And at the end of the day, at the end of 10 years, that federal local share remains at a 90-10 match, probably the single most generous program ever put forward. We also know that the other individuals will be eligible for new marketplaces, private plans that will operate here in Pennsylvania around a set of rules. And again, 90% of the folks will be eligible for some financial assistance. I was really delighted to have a chance to talk to some key advocacy representatives, stakeholders, and provider groups that the mayor helped to bring together today. These folks will be critical here in the front lines, beginning to educate people about what's going to happen later in the year, beginning the outreach, and helping us begin to identify populations who are going to need particular help and assistance with language issues because they haven't ever been in the health insurance market, so they need some additional questions, they need some help figuring out what works. So I'm here to say thank you to the advocates for joining me today. Roll up your sleeves. We have a lot of work to do in the months to come, and I look forward to working with Mayor Nutter and his team to make sure that at the end of the open enrollment period, which will be March of 2014, I can return to Philadelphia and talk about the fact that a large number of the uninsured population now has, for the first time ever, affordable, available health care here in Pennsylvania. And with that, I think
We'd
turn it
be
back to the mayor.
glad to answer any questions, and let me just make one other additional note, certainly with Dr. Don Schwartz here. You know, I mean, it may seem rather obvious, but sometimes the obvious bears repeating. The more people who are insured, the more people who have great and high-quality health care, one, the better off they're going to be and improved quality of life. We've seen in recent times a bit of a surge, quite frankly, in utilization at our own city health clinics, and that obviously has an impact on us, the city government. The opportunity to partner with the federal government, utilizing their resources, utilizing programs that are already in place, is just a winner all the way around. And we look forward to working very, very closely with you, Madam Secretary, to make sure that Philadelphians, Pennsylvanians, and Americans can lead quality lives with affordable insurance and not be denied their coverage because of previously existing conditions or a variety of other barriers that have been created out in that private marketplace. And our president fought that fight. It was a fight worth fighting, and he was successful. With that, I'd be glad to answer any questions that you might have.
How many people are impacted in Pennsylvania, and is up to this point, at least, the governor said he's not going to agree to the expansion of Medicaid managed care. What's the current status of that? How do you move forward given that circumstance?
Well, we think that there are about 1.2 million Pennsylvanians who are without insurance or who are buying insurance in the individual marketplace, and that's really the population to whom the new law would apply in terms of expanded coverage. First of all, there is no timetable for a governor to make a decision about Medicaid. The offer is on the table, and I know Governor Corbett and his team will be coming to town with other governors this weekend. I know that Joanne Grossi had a recent conversation with the health commissioner in Pennsylvania. We'll be having those conversations as we go along, because I think that what we saw, at least in the children's insurance program, the last major expansion of insurance, is that while a number of governors started out saying by the end of year 3, every single state was part of the program, and frankly, that matching share was far less generous than the 100% federal funding that's on the table right now. And as the mayor said earlier, if you think about it, there is a significant cost to doing nothing that I think needs to be discussed. First of all, hospitals bear the cost of patients coming to access care that have no way to pay the bill, so that those costs get distributed to paying customers, and so everybody's insurance rate goes up. The workforce is less productive if you can't get preventive care and primary care and get checkups. You end up being much sicker and in a more difficult. Our kids are less productive as students if they don't have access to regular checkups and regular care. If a second grader is sitting in a classroom and can't see the blackboard, or can't hear the teacher, or has such pain that he or she can't study on a regular basis, that has an impact. So there are some big impacts on the state for leaving people out of the insurance market altogether. And I'm hopeful that governors who at least initially said, we're not sure if we can afford it, we're not sure how this works, we're eager to be flexible. Every state has different challenges, different issues. So I'm eager to talk to the governor and his team about what would work best for here in Pennsylvania to make sure that people have affordable care.
How will the benefits that you mentioned be affected by sequestration?
There is no direct connection. The current looming sequestration will affect our department. Every agency will have to cut 5% from the overall budget. Medicaid is totally exempted from those cuts, so there are no cuts to the federal state Medicaid program now or in the future. Medicare is partially insulated, so there is a cap of 2% on cuts to Medicare providers. So a lot of what we're talking about really won't be directly impacted in terms of the programs. It will fall more on other areas. Having said that, there's a serious hit to the middle class, to the citizens that we're trying to make sure get ahead with sequestration. We think about 70,000 parents will lose their child care slots, which will make it much more difficult for those parents to go to work if they don't have effective places. We will lose thousands of Meals on Wheels opportunities because that funding will be cut. Thousands of NIH grants, which go to the University of Pennsylvania and schools across this country to work on accelerated cures and help people with diseases, will have to be cut. Food safety inspectors, making sure when you sit down for lunch or dinner that the food that you're serving your family is safe and clean, will be jeopardized. So I am very hopeful, as the President called them to do yesterday, that Congress will come back to the table. They're on vacation right now. They took the week off. I'm hopeful that when they return, they will address this issue because we need a big budget deal. We need a balanced approach to a long-term fix for our deficit and investments in education and infrastructure. And having this fall on people's heads starting March 1st makes no sense.
It would be a colossal act of incompetence by the Congress to allow something like this to happen when it doesn't have to happen, it shouldn't happen, and they can actually do something about it. Any other questions?
Is there a place where Pennsylvanians can go to find out guidelines about whether they're eligible to become a current?
There is a website up and running, currently available in both Spanish and English. It's healthcare.gov, and a Pennsylvanian right now can figure out what's available in the market today, what's coming, what the law says, you can't actually early enroll until October 1st, but you certainly can get information. And if someone comes in and signs up on that website, healthcare.gov, we will be sending regular updates and information about exactly what is happening and what kind of timeline, and keep people informed as the year progresses. So healthcare.gov is a great one-stop shop.
Thank you all.